All right, so again, good afternoon. Thank you for joining us on this Wednesday, August 28th. Again, I'm Kristen Shanahan, the Public Information Officer at the Louisville Metro Department of Public Health and Wellness. As you are aware, we are here to discuss Jefferson County's first case of travel-related Oropouche virus infection. Joining us to explain what Oropouche virus is and how to prevent becoming infected is Dr. Chris Bryant, our Associate Medical Director and Pediatric Infectious Disease Specialist at Norton Children's. We also have Matt Vanderpool on, a Public Health and Wellness Environmental Health Specialist. He is what we like to call our bug expert and works in our mosquito and tick control program. Also joining us is Dr. Patricia Bautista Severa, the current chair of the Louisville Metro Board of Health and the Health Empowerment Coordinator for La Casita Center here in Louisville. I'd like to ask everyone to mute your devices, which they should already be. And when we turn to questions, please raise your hand so I can call on you, or you can put your question in the chat. For members of our Spanish media, feel free to ask your questions in Spanish, and Dr. Batista will facilitate translation. So let's start off with Dr. Bryant. Dr. Bryant, can you please give us a situation update?
Thank you, Kristen, and welcome everyone. An individual in Jefferson County has been diagnosed with Oropouche virus infection. This individual had recently traveled to Cuba, where there is an ongoing outbreak of Oropouche. Now, this individual is fortunately recovering and doing well. The individual is one of about 22 cases nationwide that have been acquired during travel abroad. Oropouche is a virus that is transmitted to humans by the bites of midges, which are little biting flies, or some kinds of mosquitoes. Symptoms begin 3 to 10 days after you're bitten, and common symptoms look a lot like other diseases that you get from mosquitoes. So these symptoms might include fever, chills, headaches, body aches, muscle aches. Most cases are mild, as I mentioned. Symptoms last around a week, but they do tend to recur at least once. Rare cases of meningitis or severe, even fatal infections have been reported. There is no treatment for Oropouche virus. There is no vaccine to prevent it. The most important thing people can do to protect themselves is avoid bug bites when they are traveling to a place where Oropouche is being transmitted.
All right, Matt, I'm going to bring you in. Can you tell us how Oropouche is spread?
Sure, Kristen. So, Oropouche virus is spread to people by mosquitoes. It's considered a vector-borne disease. Humans are the reservoir, meaning that the virus itself is within infected people, and then a mosquito would bite one of these infected people, and then would then potentially be able to land on somebody else, and then bite them and pass the virus along. And this is different than what we see in most of the vector-borne diseases that we have in this area. The primary vector for Oropouche in South America and Central America is a type of biting fly. It's a very tiny biting midge, and it's been shown throughout all of South America, Central America, and most of the southern states, but also on many of our bordering states to Kentucky, and then as far north as Wisconsin. So there's the potential that we could have this biting fly here, but we haven't found it. So we could have the midge. We may not have the midge. We are just not sure. There are also 3 different species of mosquitoes that have been implicated in potentially carrying Oropouche from person to person. And then once only one of those is potentially in this area, the most northern border of that mosquito's range is Kentucky. We haven't found it in Kentucky, but again, that is still a possibility. So out of an abundance of caution, the vector control team is treating this as if it can be passed from mosquito to person in our jurisdiction, and we're combating it that way.
Paul, I see you have your hand raised.
Yeah, good afternoon. For either one of you, this sounds a lot, two questions. This sounds like West Nile virus. Is that a fair comparison?
There are a lot of similarities between Oropouche and West Nile. Some of the symptoms are very similar. Like West Nile, this can be transmitted by mosquitoes, but it's also transmitted in many places by the biting midges. There are a couple of important differences with this virus. And one is that it can be passed from a pregnant person to their developing baby during pregnancy. If we look at all of the cases that have occurred across the globe, there have been miscarriages when a pregnant person has been infected, and some congenital malformations. So that's an important difference. And that really informs some of the prevention strategies and why there is a level 2 travel alert for pregnant people to Cuba. So everyone going to Cuba is urged to prevent bug bites, but pregnant people are advised to reconsider non-essential travel to Cuba. This is not a virus that we want pregnant people to get.
The first thing that came to mind when I got the email, well, and I've been in this business a long time. This is the first I've ever heard of this virus. And now the health department's holding a Zoom conference. Should I be alarmed? Should we be alarmed that this virus has found its way into Jefferson County?
Oh, Paul, I'm so glad you asked that question. So, no, we don't want anyone to be alarmed. We are holding a press conference because this is the first case of Oropouche virus infection identified in Jefferson County. It's the first case identified in Kentucky. Yesterday, the CDC released a report describing 21 other travel associated cases in the US through August 15th-ish. And so this is an evolving situation. We want people to be aware. So that's number one. Number two, we want to make sure that people traveling to Cuba and other places where this virus is spreading know about it and know what to do to protect themselves. And so, one of the most important things you can do, and Matt can talk more about this, is use insect repellent. Now, there are also some recommendations for people who have traveled to areas where this virus is spreading, like Cuba, special things that you should do when you come home. And so the CDC recommends that people who are returning to the US from places where the virus is spreading, such as Cuba, take care to prevent bug bites for 3 weeks after they return home. So that means wearing insect repellent to the extent you can, wearing long sleeves, long pants, staying in the air conditioning. If you've opened your windows, use screens. And that is really out of an abundance of caution. Because as Matt mentioned, if I have the virus in my blood and a mosquito bites me, and then it bites someone else, that could transmit the virus. We don't have virus transmission in the US. We don't want virus transmission in the US. So we just want to make sure everybody knows how to be safe, and they can enjoy safe travels.
And Dr. Bryant hit on something, and you had asked originally, what is the difference? Is this really just kind of another West Nile virus sort of thing? So within humans, West Nile virus, we're a dead-end host. Mosquitoes can't get it from us and then pass it on to other people. That's what makes Oropouche a little bit different. And that's what that additional strategy of, if you have traveled to areas where Oropouche transmission is occurring, when you come home, you still want to use insect repellent to keep mosquitoes and biting insects away from you, to reduce any potential that could be passed from person to person. So it's protecting the people around you once you come home. And yes, that is an abundance of caution, but that's wherein both of these diseases differ significantly. People are the reservoir for Oropouche.
And I see Louise joined. a moment ago. Louise, did you have any questions? Or Jose? Xavier? Any other reporters that we have on? Louise, did you want to ask a question?
Quick question. Hello to everybody. Thank you for doing what you're doing. Is it going to have an official warning to the community? I mean, how the people will know about it?
Luis, I'm glad you asked that question. Those of you who are gathered here today are going to be very important in helping us spread the word to the community. We'll be communicating through our community partners. Dr. Batista Severa might want to mention more about that, but we appreciate each of you helping us spread the word about this virus.
Thank you.
And if I may, the Pan American Health Organization has described that this Oropouche infection is not only happening in Cuba, but other Latin American countries and Caribbean, Colombia, Cuba, Brazil, Bolivia, Peru. But unfortunately, the community that is traveling the most to the country that is having several cases, many of them undocumented or not very well documented, it's Cuba. And Louisville has the second largest Cuban community. So we are doing this, calling to the community to alert our Cuban community to take precautions before traveling, while they are traveling, and when they are coming back, in order of prevent any human-to-human infections through the vector, through mosquitoes. That's why we're doing what we're doing today.
And Dr. Bryant, can you go over the signs and symptoms of Oropouche and then talk about any treatments?
Yes, so Oropouche causes fever, chills, headaches, muscle aches, body aches. Those are the most common symptoms. And they begin 3 to 10 days after you're bitten. They last about a week. Now, many people feel better for a few days, maybe a week, and then the symptoms recur. That's very common. This virus can cause more severe disease. It can cause things like meningitis or an inflammation of the fluid around the brain. There have been a small number of deaths reported out of the more than 8,000 cases that we know about that have occurred across the world just this year. As I mentioned, this virus can also be transmitted from a pregnant person to their baby prior to birth, and that can result in miscarriage or other adverse pregnancy outcomes. There's really no antiviral treatment for this. The treatment is supportive. One important thing to know is that when there is fever and you want to treat the fever, you should use Tylenol, also called acetaminophen, rather than medications like aspirin or ibuprofen or Motrin. And that's to reduce the risk of bleeding. This viral infection occasionally causes bleeding. The symptoms look a lot like dengue, which is another mosquito-borne illness that can cause bleeding. And so we don't want to give any medication that might contribute to bleeding. And so Tylenol for fever.
And then can you remind people, Dr. Bryant, of what to do if they have recently traveled to Cuba and are seeing these symptoms?
Yes, I think anyone who has traveled outside the US, whether you've been to Cuba or one of the other countries that Dr. Batista Severa mentioned where transmission is happening, or you've just traveled outside the US and you develop a fever. Be sure and tell your doctor or healthcare provider where you've been, because different infections are prevalent in different places. If you know that you've been someplace where Oropouche is spreading, and you're worried about that, talk to your healthcare provider. This is a new virus to doctors in our area. And so if you think you might have been exposed and you develop a fever, just be sure and share your travel history.
Great advice. Thank you, Dr. Bryant. And Matt, can you expand on, we've talked about other diseases that mosquitoes, ticks, other insects can carry. It's important to always protect yourself against insect bites. Can you talk about ways in which you can do that besides wearing insect repellent?
Sure. So with mosquitoes in general, I mean, all mosquitoes require standing water to be able to breed. So one of the best things that anybody can do is to look around their property, look around their around their apartment building, their house, even when you're talking to your neighbors over the fence and whatever else. Just look for things that could be holding water, and these things can be as small as flower pot saucers, bird baths, fountains that aren't running. So mosquitoes generally are not going to be breeding in running water. So if you have a stream out back that's flowing and has fish, that's really not going to be a problem. If you have a pond nearby that has fish and an ecosystem, that's probably not going to be your problem. However, if there's a stagnant swimming pool that's turning green, or a bunch of tires in the alleyway or something along those lines, those types of standing water are what you're going to have a lot of mosquito breeding in that are going to cause a lot of problems for you and your neighbors. So, number one, see that you have those. If it's within your power to turn over that water, empty things out, that's going to do you the most good. Making sure that your gutters are properly draining. You don't have, water sitting in your gutters, or they're not, the downspouts aren't clogged. Taking care of those things. Anytime that you have any mosquito issues in your yard, you can always call Metro Call 311. You can make a complaint through Metro Call 311, and one of our environmentalists will come out, look at your yard, look at the neighboring yards, and see if we can't figure out where those mosquitoes might be coming from to be able to take care of that. Now, besides just checking out the environment where you live, we've said several times, you should wear insect repellent. There are a lot of great EPA recommended insect repellents that are on the market. And there's links on our vector control website to EPA recommendations for those. It's also, as much as I hate to say it, it's really hot outside, but wearing long sleeves, long pants will keep midge flies and mosquitoes from being able to get in contact with your skin, and that can help. And also just kind of changing what our normal rhythms are. I mean, it's still summertime. We like to be outside, but mosquitoes are going to be outside. They're also going to be most active in the early morning and in the afternoon and at night. So as much as we can limit our time outside during those times when mosquitoes are going to be most active, that's going to help us out the most. And if we have to be outside during those times, you should absolutely always be wearing insect repellent to try and make yourself not smell good to mosquitoes so they're not going to bother you.
Thank you, Matt. And Paul, I see you have your hand raised again.
Dr. Bryant, just a quick question. Is it fair for me to characterize or describe this as a rare virus? Is rare a good word to use?
It is absolutely rare in the United States. Globally, there have been more than 8,000 cases this year. So it is a virus that has been very uncommon in the United States, but we are seeing increasing reports of travel-related cases like the one in Jefferson County. And I anticipate that we are likely to see additional travel-related cases.
And just to confirm what you had mentioned earlier, this is the first confirmed report ever in Jefferson County and Kentucky?
This is the first confirmed report in Jefferson County. And to my knowledge, we have not had other cases in Kentucky, certainly not this year, coincident with the increase in cases globally. This is not a brand new virus. This virus was described initially, I think, back in the 90s. But what's happened this year has really been a big increase in cases globally.
Thank you.
Thank you, Paul. Anyone else have any other questions? Okay. All right, I'm going to leave it to our interviewees to share their final thoughts. So, Dr. Bryant, I'm going to start with you.
Oropouche virus is a virus that is transmitted to people by biting midges and mosquitoes. We've identified a travel-associated case in Jefferson County. It is important for people to take steps to protect themselves against insect bites. And whether you're traveling or you're staying at home, that's an important take-home message.
And Matt, do you have any final thoughts?
Sure. Just briefly, and it piggybacks off of what Dr. Bryan is saying. Just make sure that anytime that you're going to be outside, I mean, you can't look at an insect, mosquito, otherwise, and say, oh, this one has a virus and that one doesn't. You just can't do that. So it's always important that you're taking whatever precautions that you can to avoid insect bites, period. If you're traveling internationally and you're coming back, make sure that you're wearing insect repellent if you've been in these areas where Oropouche is being transmitted for 3 weeks, so that it reduces the potential for the virus to maybe get into the population of mosquitoes that we have in this area. And the health department is very familiar with different vector-borne diseases. We've had a program established for the last 68 years. We're going out, we're dealing with the virus in the mosquito populations, just like we would with West Nile virus and other diseases. So this hasn't kind of caught us by surprise. We know how to handle these sorts of things. So the public can be, assured that the health department is actively taking measures to deal with this, and that if they have any mosquito issues, they can always call Metro Call 311.
Good reminder, Matt. Oh, and Louise, you had a question? Oh, you're muted.
Okay, sorry. Just a quick comment. Cubans are traveling to Cuba, but they are not traveling from Louisville Airport. They have to go through Miami or Tampa. So I will say that first they are coming through these cities, and later they are coming to Louisville. Just for general information, because there is no any flight, the direct flight from Cuba to here. Just a quick comment. Other than that, thank you for inviting us, and let me know as soon as you have information so we can start sharing with the rest of the community.
Thank you, Luis. And so you raise a good point that we need to think about how people are traveling. The symptoms that don't develop immediately after you're bitten, the symptoms develop 3 to 10 days after someone is bitten. So someone could be in Brazil or Peru or Cuba or any place where this virus is being transmitted. And even if they take a circuitous route home back to Louisville, or it takes a couple of days, we need to let them know what to watch for, because the symptoms may take a few days to develop.
And Dr. Bautista Severa, can you also give us your final thoughts and then go over the key messages in Spanish for us?
Yes, for sure. This is just a highlight of what Dr. Bryan has been sharing with us. The 21 cases that have been reported in the country have been related to international travel. And most of these cases, just seconding what Luis David Fuentes is saying, are located in Florida. Querida comunidad, la infección por el virus de Oropouche no es nueva. Los primeros casos fueron descritos en 1956 aproximadamente. Hay casos descritos en Cuba, en Colombia, en Brasil, en Bolivia y en Perú también. Sin embargo, la mayor parte de casos ahorita que se han descrito están en Cuba. Por lo tanto, esta reunión es para recomendarles el que tomen medidas de prevención. Prevención cuando viajan, lleven repelentes, usen manga larga en las piernas y en los brazos y eviten las picaduras de mosquitas pequeñitas y de mosquitos grandes también para prevenir cualquier cosa. Y a su regreso también manténganse alertas con cualquiera de los síntomas que la doctora Bryan describió: fiebre, dolor muscular, dolor de cabeza, ataque al estado general. Pueden ser leves o pueden ser severos. Vigilen, estén alertas. Si alguien tiene dentro de los 3 a 10 días después de que regresan de viaje alguno de estos síntomas, por favor, acudan a su médico y reporten que son viajeros internacionales. Y si son viajeros internacionales y regresan, las 3 semanas después de que regresan, por favor, usen medidas preventivas para que no tengan picaduras por insectos, en favor de ustedes, de su familia y de su comunidad. Eso es todo.
Thank you so much. Does anyone else have any final questions before we wrap up? Okay, thank you everyone for joining us and sharing this important message. And thank you, Dr. Bryant. Thank you, Matt. And thank you, Dr. Bautista Severa, for joining us and taking your time to share this information. All right, everyone have a great day.
Thanks to everyone for helping us share this news.